Hello, my name is Philip Williams. I am a pediatrician and also the Associate Medical Director here at Mariposa. It is always a pleasure to speak to you today, and I think we have a very exciting topic. Before we get too far in, I first just want to introduce two of my esteemed colleagues. We have Brenda Coppola and also Dr. Carla Taveras here with us today. And first, just want to learn a little bit more about both of you. So I'm going to start with Brenda. Please tell us about yourself.
So delighted to be here today. I've been a part of Mariposa as Director of Nursing for 17 proud years and here with our lovely colleagues.
Brenda is also not only a wealth of information, but also a huge source of energy for our clinic. If you come into our clinic, you will always see her bright and shining face. So we absolutely love that about you, Brenda. So thank you for joining us.
Thank you, Dr.
And also, Dr. Taveras, thank you so much for joining us as well. Please tell us a little bit about yourself.
So I'm also happy to be here. I've been working with Mariposa for a year and 2 or 3 months, and I'm really happy right now.
So Dr. Taveras actually joined us for another Mariposa Talks We Love Nogales session. It was a few months ago.
Yeah.
We learned a little bit about her, but for those of you who were not able to view that, please tell us about yourself. And I know a question you always get is, what led you to Nogales?
Yeah, from the Dominican Republic to New York and then Nogales. I was looking for a safe and welcoming community that feel like family, and this is exactly what I found here.
I would say that we are also we speak Spanglish here in Nogales, so we're going to do it both in English and Spanish if that works for both of you guys.
Absolutely.
Perfect,
Yeah.
perfect. So, I first want to focus a little bit on our pediatric services. Many people in the community know that at Mariposa we have 2 main pediatric locations. We have our Nogales location and what we call our Sierra building. It's our 2-story building on our main campus. Then we also see kids in Rio Rico. We have now, 7 pediatricians, so huge team available to serve our patients. And then also some of our family practice doctors also see kids, both in Tubac with Dr. Quincy, at our Nogales location with Dr. Shavita. Then also in our location right next to the hospital, we have Veronica Borbon and Lydia Rivera, who have been there for many, many years, who also see kids. But, first question is for Brenda. I think our pediatric practice, we do a little bit more than a typical practice.
Absolutely.
Can you speak a little bit in terms of some of the services that our nurses provide?
Sure. Not only do we have our wonderful team of pediatricians that we get to learn from and work with side by side, but we also get to support orders and endeavors that need to be carried out. By expanding what we can provide at our community health center without having to send patients out for services elsewhere. One of the biggest items that we like to focus on is access to care. So if there comes a time where for some reason you weren't able to get an appointment with a provider, we always have our licensed staff available to assess those patients and help facilitate access to an appointment based on the urgency and need. Another item that we focus on is vaccines. We look at schedules, we work with our pediatricians, and we ensure that all of our patients receive what they are due for to stay safe.
I think we were lucky this year in terms of our respiratory season. Typically we see a lot of kids with RSV. I think that recent advances such as what's called a monoclonal antibody that we give to kids, essentially a immunization for kids for RSV, and also vaccines for pregnant moms has really helped to decrease the numbers. But, really quick, because we still are in RSV season, at least for another few weeks. Dr. Taveras, can you tell us a little bit about what is RSV?
RSV is a virus that affects the lungs. It causes, with babies, what happens is that they cannot use their mouth to breathe. So even things like nasal congestion can be really bad for them. RSV causes a massive production of boogers, and it's so important that it ended up causing inflammation of the lungs too. So it can be really bad on them. But RSV causes a lot, that's what it causes. It's just a virus that to us, it might be nothing, but to them, it can be really, really bad.
And also, Dr. Taveras, if you can explain in Spanish, a lot of questions we get is, how do I know, is it a bacteria, is it a virus? And then also, when do I need to come to the doctor? Can you expand a little bit more upon that?
¿En Spanish or English?
Claro que sí, en español, por favor.
Para ser honesta, yo siento que si los padres están preocupados, ellos deberían de ir al médico. Si sienten que es algo que se les puede salir de la mano, cualquier cosa, yo siento que deben de ir al médico. La diferencia entre el virus y las bacterias es más microbiology. Es cómo se comportan y cómo sobreviven. Y el tratamiento es completamente diferente. Asimismo, cómo se manifiestan y dónde están afectando. Los virus, la gripe normal, se les quita solo sin ningún tratamiento. Las bacterias necesitan tratamiento para que el cuerpo pueda eliminarlos bien.
Thank you so much for explaining the difference. A common question we get is, when should kids come to the pediatrician or not? When should they come to the doctor? I know that there's a lot of guidelines in terms of when we want to see patients. For instance, if you have fever for 2 or more days, if it's high fever, the kids aren't eating and drinking well, if the kids, have a decreased number of urine output or wet diapers in babies. What are other things that you both would say in terms of, reasons that kids really have to come to the doctor? What else would you say?
If they're having difficulty breathing, if, like you mentioned, if they're not eating or drinking, especially if they're not drinking, because even adults, when we get sick, if we're not gonna get hungry. So it's okay if we don't eat for a day, but if you stop drinking altogether, they can get really dehydrated, and that's more delicate.
Speaking of dehydration, Brenda, we have a lot of services for kids who are dehydrated. You mentioned trying to prevent kids from having to go to the ER, to other places. A lot of that we can do at Mariposa. If you could just explain a little bit in Spanish, if you have a kid that, Dr. Tavera says, this kid really is dehydrated, they need something else. What, role or what kind of things would the nurses do to help that child?
Gracias, doctor Williams, por esa pregunta. Va a ser una combinación con los comentarios que hizo doctora Taveras. Si tienen alguna preocupación, alguna duda, si su hijo o hija no está actuando normal o algo se siente que no está como usualmente ve el comportamiento de sus niños, por favor tráigalos a nuestra clínica. Para eso estamos las enfermeras, nuestro personal, para asesorar al paciente, asegurar que no hay algo urgente, que tuviéramos que tomar acción el mismo día, o si es algo más transitional, como la gripa común que mencionó doctora Taveras. Pero igual, para eso estamos, para asegurar que no vaya a haber una complicación. Hablando de deshidratación, ya vienen los meses más fuertes del calor aquí en el sur de Arizona. Nosotros tenemos servicios para asegurar de que podamos atender al paciente, ya sea con suero intravenoso o medicamentos adecuados para reestabilizar al paciente, sin tener que ir, como dice el doctor Williams, ya sea al hospital o a otro sitio.
And the great news is that, we've done a lot of recruitment within the last few years. And currently, again, we have a large team of pediatricians and nurses. It's very easy to make an appointment to see one of our pediatricians. We have same day availability. Can you just quickly, tell our viewers, if someone wants to make an appointment at Mariposa with a pediatrician, what do they do?
So give us a call. Give us our call to our main line. Our call center staff will look for an appointment that best fits your schedule or based on the urgency and the need of the complaint. Like Dr. Williams mentioned, we have same-day availability for consultation or same-day walk-in availability as well. And of course, we can help schedule your regular well child checks at the appropriate interval and time that they are due, which includes getting those patients up to date with their vaccines.
And I'm so glad you mentioned well child checks, because I think as pediatricians, that is one of the most important things that we do. Dr. Taveras, if you can kind of walk us through, one, what is the importance of a well child check? And then two, what should families expect whenever they bring their kids in for a physical?
Las visitas anuales es donde nosotros los pediatras vemos que estén creciendo bien, que estén aumentando bien de peso y que se estén desarrollando de manera apropiada, así como que tengan todas las vacunas al día y podamos hacer todas las evaluaciones que se hacen todos los años o algunas no todos los años en cuanto a laboratorios y esos. Y sí, es muy importante, porque así sabemos si algo no está bien a tiempo y podemos hacer los referimientos apropiados.
Yeah, we always say that prevention is absolutely key. And again, part of our job isn't just to address the acute issues like colds, fevers, is also to make sure that you're growing well, developing okay. So that's exactly true. I do want to spend a little bit of time. I am very, very excited about an upcoming event that we are going to have at Mariposa. We're calling it our Teddy Bear Clinic. So we all know that, kids, even, it doesn't matter the age, I'm 46 and I still love teddy bears. I still love, going to Build-A-Bear. We're going to have a very similar event. It's going to come up on April 11th, where essentially kids are going to come to the clinic. It's going to be April 11th from 10 until 1. They're going to receive free teddy bears. We're going to have various stations set up, so kids are going to be able to take their bear and do a lot of different things that Brenda is going to talk more about. And then we really are going to encourage kids to bring your teddy bear to every single physical. We're going to have different areas in our exam rooms that the kids can examine their bear at the same time that I'm doing a physical on kids. We're going to have a lot of prizes, a lot of accessories that you can get from your bear. But I could talk about this for hours. Before I get too far deep, please, Brenda, tell us a little bit about our upcoming Teddy Bear Clinic.
Thank you, Dr. Williams. I am so excited to speak about our event that's coming up. We have our lovely teddy bear here with Dr. Taveras. So the children that will be coming by can expect to receive this lovely teddy bear, and they will be walking the teddy bear through what a well child check or doctor visit typically looks like. This will help decrease their anxiety and have an expectation of what it's going to look like when they go to visit their doctor. So they will walk the teddy bear through an intake that looks like, or actually hands-on, taking vital signs. So taking the bear, our patient bear, temperature, height and weight, blood pressure, and even administering a vaccine at the end of their visit. They will get a certificate, as Dr. Williams mentioned, and they will also get a passport booklet that they can bring to subsequent visits and that we will stamp every time they come through. So it will be super exciting, super interactive. Really looking forward to having our community come by.
Just like Brenda mentioned, we're going to have a lot of different stations. In addition, we're going to have a casting station. So we're going to be able to do an x-ray in your bear. So if your bear has a broken bone, we're going to be able to put a cast on it. IVs is another thing they're going to be able to practice with their bear. So again, the whole point is really to make it interactive and fun. Very, very excited. I think, we're going to have food. We're going to have, lots and lots of events. And just like Brenda said, I'm really excited about the passport because, again, every time that you come to a visit, you're going to get a stamp. And after you get a certain number of stamps, you're going to get other accessories for your bear. So I think it's really going to be a great community event. Dr. Taveras, I know you're excited about the bear as well.
I am definitely excited. I mean, imagine the kids getting so happy about taking their own bears to my appointments.
I know that Edgardo is going to put information for the Teddy Bear Clinic on the screen, but just remember, it is going to be on Saturday. It's April 11th from 10 a.m. to 1 p.m. It's going to be at our main location in Nogales. Please come. It does not matter the age, young or old, from babies all the way up to teenagers. I think, my 28-year-old, she's going to be there, and she's excited to get her bear. So it doesn't matter the age. Please come by, and please come and celebrate our teddy bear. We're also going to have a life-size bear. Is that correct, Brenda?
We are. We're going to have the opportunity to meet our official Dr. Oso mascot.
Yeah.
You'll be able to take pictures and post them online and share them with your friends. This is a great opportunity for us to re-engage with our patients, with our community, and to meet our care team and our lovely pediatrician providers. So come on by. I'm looking forward to it.
So please, again, young and old, come. It really is going to be a very, very, very fun event. So as we wrap up, I just want to ask you kind of one last question. One, is there anything that you think that our viewers should know? Any pediatric updates? One question that I commonly get is in terms of vaccines. What are the recommendations? I'm sure many of you know that the American Academy of Pediatrics still recommends our normal schedule of vaccines, including the hepatitis B vaccine at birth. I know we've gotten a lot of questions, Dr. Taveras, about the importance of the hepatitis B vaccine. Do you want to just quickly talk about why specifically that vaccine is important for newborn babies?
So, primero, recordar que hay mucha desinformación en el mundo ahora mismo con las redes sociales. Es bien fácil que alguien sin conocimiento empiece a divulgar información errónea. La vacuna de la hepatitis B es la que se pone cuando acaban de nacer. Y la razón por la cual se pone específicamente ahí es porque los bebecitos, los niños, cuando adquieren el virus, no necesariamente a través de los padres, hay otras vías, se hace para toda la vida y la mortalidad es mayor. A los adultos, cuando nos exponemos al virus, aún sin la vacuna, la probabilidad de que simplemente lo eliminemos nosotros mismos de forma natural es bien alta, pero los bebecitos no. Y pueden ocurrir muchos accidentes. Cuando estén aprendiendo a caminar pueden haber cortadas, pero incluso antes pueden haber otro tipo de accidentes en el que se pueden exponer al virus. Y 90% de los niños llegan a ser crónicos y no queremos afectar nada de la salud de nuestros bebés.
Great information. And then, Brenda, I know the meningitis vaccine is something that you are very passionate about. Well, you're passionate about all vaccines.
Yes,
but,
absolutely.
Just tell us a little bit about the meningitis vaccine. What age is that typically given?
Yes, so the meningitis vaccine is given initially at 11 years of age. They receive a booster at 16 years of age to complete that series. And then we also administer a sub-meningitis B vaccine at 16 years of age as well. This ensures that they stay protected during this chapter, the teenage years of their life. And I also want to emphasize that we have all vaccines presentations available at Mariposa Community Health Center. If you're looking for something specific, come to us and we'll help facilitate that. If you have questions, concerns, we are there to help answer and travel through that decision making together so that you feel comfortable in the next steps that you take with your family.
I love that. It truly is a journey. We truly are a team. So I really like that. I just want to thank all of you for joining us again today. Again, just want to thank my esteemed colleagues, Dr. Taveras, Brenda Coppola, for joining us today. We hope to see you on April 11th from 10 a.m. to 1 p.m. at Mariposa at our main location in Nogales. Please come to the Teddy Bear Clinic again. It really is going to be a wonderful, wonderful event. Thank you.
We'll see you then.
Bye, thank you.